Okay, welcome everyone. We're going to get started. My name is Jonathan Fox from the Accountability Research Center, and we're pleased to welcome you to this workshop on, or breakout session on investing in grassroots leadership development. And we're very pleased to be able to welcome Joy Aceron, Director of the Government Watch in the Philippines, Paulina Culum from the Network of Community Health Rights Defenders in Guatemala, Wunna Htun, a Myanmar Program Coordinator from the Bank Information Center, and Nani Zulminarni, Director of PEKKA, the Women-Headed Households Program in Indonesia. And the format is going to be, I'm going to start with a series of questions for the group as a whole, and then a couple of questions that are specific to each of them, and then we'll open up for discussion. But I want to share a couple of words to frame the discussion and to explain why this workshop is focused on leadership development. And we're trying to find a way to engage with the conference theme on human capital, and here we are focusing on grassroots leadership. And we basically are flipping the arrow. And what do I mean by that? The main theme for the forum stresses how social accountability can help to build human capital by persuading the government to spend more money and to spend it better and to solve problems along the way. And so our agenda flips this by focusing on how it's necessary to invest in human capital in order to get social accountability in the first place. So here's the proposition. There are many different ways to encourage citizen voice, but only some of them actually encourage those in power to listen. And civic muscle matters here, and that means that organizing matters. But organizing is a skill, and skills are assets, and assets are a form of capital. So the capacity to be an effective community organizer is a form of human capital. Let me give you another example of how human capital matters for building social accountability. So to promote healthier interaction between governments and their citizens, it's worth recognizing that many societies are multilingual. Yet state actors often don't speak minority languages. So this raises the issue of language access, which is largely invisible in the social accountability field. It's often assumed that so-called local staff will somehow speak the relevant languages rather than making language access a strategic priority. But being multilingual is a skill that's often not recognized as such. And in practice, many grassroots social accountability leaders are also interpreters, helping their communities to navigate the state. Paulina, for example, speaks 4 languages. It just so happens that English is not one of them, but 4 languages is a lot. Yet, somehow, in our field, we don't see the role of community interpreter as recognized. We recognize health promoters, we recognize paralegals, but somehow community interpreters, de facto community interpreters, are taken for granted. So I just wanted to underscore this. And it's a form of invisibilizing and therefore downgrading actually existing human capital for social accountability. And if you look at the Accountability Research Center's Twitter feed, you'll see actually an experimental crowdsourcing survey where we're trying to learn lessons from the way our field has taken on the language access issues. And then before posing a question to our panelists, I just want to announce that some new work to share in this international exchange. Joy Aceron has edited a new book called Going Vertical that analyzes a whole series of advocacy campaigns in the Philippines through multi-level analysis, and it's fully online on the websites for Government Watch and for ARC. And Paulina's network of community health defenders has just completed a video, which we're going to share with you, 10 minutes. This will be the global premiere of this video. And then Nani is the lead author of a new working paper that we just published together, and this is also the global launch, let's say, of this report on the work of PEKKA. So, first I want to start off with a question for everyone, going in the alphabetical order with Joy. First, can you please introduce your organization and your goals, just very briefly, to get us started?
Hello. Good morning. Good afternoon. Good afternoon, everyone. My name is Joy Aceron. I'm directing the organization in the Philippines called Government Watch. GWatch started as a social accountability program of a university way back in 1999, so it's almost a 2-decade-old organization or work on social accountability. And we just recently spun off into an independent organization. We're trying to reboot it into an organization, an action research organization, recognizing the very rich experience and lessons to be learned from not only social accountability, but anti-corruption, transparency, participation, accountability work in the Philippines. And the idea is to generate knowledge from that vast experience and use it in coming up with new approaches and new ways of doing. We think this is a high time in the Philippines. The organization is an action research organization that is trying to embed itself in a network of civic and advocacy-oriented organizations all over the country. So we have several partners and chapters in different parts of the Philippines and all over the Philippines. Thank you.
Thanks, Joy. And before we turn to the video about the community health defenders, I want to encourage those of you who do not understand Spanish to get a headset over between the two doors over there, and you need to plug in the headset in order for the device to turn on. And channel 1 will be in English, but don't worry, the video actually has subtitles. So while you're doing that, I hope we can cue up the video and get started with that, and then Paulina will share a few words. And I'm hoping someone can turn down the lights briefly while the video is on. So, ready to go? Please start, yeah.
Los servicios públicos de salud son muy importantes para nosotras y nuestras familias, pero a veces al llegar a los servicios nos encontramos con problemas, no hay medicinas o vacunas o están cerradas. Otras veces nos enfrentamos al personal en los servicios que nos discriminan por ser indígenas, campesinos o mujeres. Y también existen algunos casos en que ante una gravedad médica familiar que necesita traslado a un hospital, las autoridades de salud nos obligan a pagar por combustibles y no nos dan comprobantes. Entonces, nunca sabemos si en verdad se utiliza para eso. Y hay muchas familias que no pueden pagar el dinero que les exigen y que se quedan en sus comunidades sin recibir atención. A través de talleres y capacitaciones hemos aprendido que otros problemas y situaciones violan nuestros derechos, de que no debemos aceptar ser discriminados, que los servicios de salud tienen responsabilidades y obligaciones hacia las comunidades, de que los cobros por servicios públicos es corrupción. Para cambiar la realidad de los servicios públicos, estamos actuando como defensoras y defensores comunitarios por el derecho a la salud. Todas y todos somos voluntarios, electos por nuestras propias comunidades para educar a la población sobre sus derechos y obligaciones en relación a la salud y a lo que le corresponde a los servicios públicos. Recoger evidencia de los problemas que los usuarios enfrentan en los servicios públicos. Defender a los usuarios cuando existe una violación a su derecho, como la falta de transporte, la exigencia de cobros. Dialogar con las autoridades y planes de acción conjunto para resolver los problemas. Apoyar a los servicios locales de salud para que el nivel central los asignen mejores recursos para atender a las comunidades rurales del país. Somos más de 160 defensoras y defensores presentes en 35 municipios del país que pertenecen a los departamentos de Huehuetenango, Quiché, Totonicapán, Sololá y Alta Verapaz.
Lo que yo hago es hacer vigilancias en los puestos CAP de San Sebastián. Nosotros tenemos que pagar pasaje para bajar en el pueblo, para ser atendidos en el CAP de San Sebastián. Entonces a veces no hay carro, entonces nos dificulta bastante por el mal camino. Es por eso que no llega el servicio allá en las comunidades. En mi caserío murió una madre por dar a luz y como ahí no llega la ambulancia, sí llega la ambulancia, pero uno tiene que pagar el combustible y con el mal camino que está, entonces y la gente no paga, aunque se puede conseguir carro, pero como la gente no tiene dinero para pagar un viaje de la casa para el puesto de salud, entonces mucha gente se muere.
Según la experiencia que yo tengo, incluso he vivido con mi propia familia y otras familias de diferentes comunidades, es que cuando uno va en busca de ayuda en el centro de salud, pues hemos encontrado a veces no nos responden o no nos platican en nuestro propio idioma mam, sino que más es el castellano. Entonces la gente a veces no solo con el dolor de la enfermedad que lleva, siempre y cuando necesita que lo escuchen. En otros casos pues a veces no son atendidos por lo mismo de que dicen que no hay medicamentos, solo dan una receta a veces recomiendan a la gente en un centro ya privado, cosa que no pueden hacer porque no tienen recursos económicos.
Empezamos poco a poco a saber cuál es el derecho, ¿verdad? Porque nosotros como gente, pues la mera verdad a veces que nos da miedo a pedir lo que de verdad es nuestro derecho, ¿verdad? Ahí me di cuenta que sí, es un trabajo, es necesario hacer, porque si nosotros no luchamos por nuestra gente, nunca no podemos, o sea, animar a nuestra gente y nosotros no podemos apoyar a nuestra gente.
Hay veces que no nos hacen caso, ¿verdad? ¿Y ustedes quiénes son? ¿Por qué vienen? Nosotros no necesitamos que nos vigilen, nosotros sabemos nuestro trabajo y nos dicen, ¿verdad? Pero nosotros, ¿verdad? Los que nos animaron son las personas que lleguen a consulten en los puestos de salud. Hay veces que no los atienden bien, no los toman en cuenta, espero mucho tiempo, pero ahora, cuando ya conocimos nuestros derechos y todo, gracias a Dios, ¿verdad? Todos los trabajadores de la salud nos respetan, nos llaman por cualquier cosa, por cualquier problema hay en los puestos de salud, nos llaman para solucionar todos. Tal vez nosotros no solucionamos todo, pero por medio de nuestros alcaldes comunales, ellos son los que nos apoyen para solucionar cualquier problema de la salud.
El valor que tiene la vigilancia que efectúan los vigilantes para los servicios de salud es poder tener de primera mano información sobre la forma que se están prestando los servicios de salud desde el punto de vista de la población. Creemos que es sumamente valioso para nosotros porque nos permite en algún momento hacer las correcciones para prestar un mejor servicio y que la población tenga la confianza de que va a ser bien atendida dentro de nuestras unidades. Entonces es necesario involucrar también a las autoridades locales para que ellos asuman la parte de la responsabilidad que les corresponde, y esto se logra de una manera más fluida si tenemos a la organización, a los vigilantes, que ellos sirven como enlace para que sensibilizar también a estas autoridades para que trabajen con nosotros y que al final de cuentas se logre beneficiar a la población.
Yo quisiera informar también que en nuestros pueblos y en los departamentos y a nivel nacional, no solo ahí necesitamos el mejor servicio de salud, sino que también en las áreas rurales, donde están muy lejanos de nuestro país, que también hay una necesidad más en cuanto al personal de salud, medicamentos, pero también al mismo tiempo necesitamos infraestructura para poder mejorar el servicio de salud. Como defensoras y defensores buscamos continuar con el diálogo y trabajo conjunto con los servicios locales de salud para poder resolver los problemas estructurales que afectan el acceso a los servicios de la población. Nosotros pensamos que si logramos resolver los problemas estructurales, todas las comunidades rurales se van a beneficiar, aún aquellas donde no existen defensoras o defensores comunitarios. Entonces, nuestra meta es nuestro compromiso y trabajo voluntario beneficia a la mayor cantidad de la población posible. También estamos forjando colaboración con otras organizaciones del Estado, como la Procuraduría de Derechos Humanos, para solucionar los problemas y defender nuestros derechos en una forma integral.
So you'll be able to find this video online at SEG's website, and also with a link from our site connected to an accountability note about this line of work. So as you're about to find out, Doña Paulina is also the narrator of this video. So entonces ahorita quisiera pedirle Doña Paulina algunas palabras adicionales.
So I just ask Doña Paulina to add a few extra words.
شقاقي ونهيل إشقي خاشش
Good afternoon to everyone. My name is
Maya Tsutujil. Vengo de San Pablo La Laguna, el departamento de Sololá. Bueno, el trabajo que realizamos en realidad es un trabajo
It has cost us a lot. It's not been easy, but at the same time, it is very important for us. It's also work that we carry out as community health defenders when we meet other partners on the road that work with SEGs. And as a local health organization, we have wanted to, but have never been able to work professionally due to a lack of financing, a lack of knowledge of the right to health care, a lack of knowledge about the laws that protect health care at the national level as a human right. In the first article of the Guatemalan Constitution, it mentions that the government has the right to provide the best health care to men, women, children, and young people, but the government has not complied with this. The work that we carry out as healthcare defenders is more focused on the more rural communities in our country. We find users and we do oversight work. We carry out interviews. We also have a platform for filing complaints in terms of discrimination, mistreatment, a lack of medication, among other issues. And that has supported us a lot because that platform arrives to different institutions, especially the Ministry of Health. We also carry out interviews and when we as health workers, when they would see us, people would ask, who sent you here? What are you doing here? And then the questions started to come. And we said that we're here because there is a need and because of the situation going on in the municipality, in the department, and at the national level. We have achieved some good things for us. For example, in the departmental hospital of Solola, we had to carry out a first oversight visit. What we found and what the users were telling us is that they do not speak the Cachiquel, Quichen, Situjil languages. And that was to their detriment because many don't receive medication, many are not well taken care of, and at the end of the visits, we always ask for 15 or 20 minutes to speak with the hospital director, and she opened her door to us to inform us what's going on in the hospital. Days later, or rather months later, when we were in a meeting with her, she said that unfortunately 100% of the people that work are Mayans there, but many times because of their uniform or the work that they're carrying out, sometimes they're obligated to speak Spanish, or maybe they're not willing to speak the language. So what did we do there? We were able to achieve that all of them started speaking in their languages, used traditional dress, and at the same time, there are now traditional dress scrubs that these workers can wear. So we've achieved a lot. There's also an external meeting to make decisions, and you have to leave at 3 or 4, an external doctor's visit, and one has to leave at 3 or 4 in the morning to get to that doctor. These very rural communities, it's very difficult to get a ticket at that time of the day, and as defenders, we were able to extend service by 1 hour because in our communities, we don't have the possibility of having transport at that time. But the director said that she would extend the schedule by 1 hour, and now there is 1 more hour of service so that the users that come from farthest away can be seen by doctors. I don't think that everyone that works in the healthcare issue is bad. There are plenty of good people, but unfortunately, not everyone has the willingness to improve their work. But with great difficulty and lots of obstacles, we have achieved these things as defenders, and we'd like to thank SAGS for accompanying us and has provided us with training and has also provided us with the knowledge about the healthcare law. If it weren't for that, we would not be able to demand the right to healthcare. But now, we do. And also, something we're trying to do is to involve young people in this space because they also have the right to know about their right to health care, not just us. They also have that right. Mostly, we women that arrive at a healthcare facility or a hospital because our husbands go to work and they can't miss a day of work because they'll miss out on 35 to 40 quetzales for not working. And and most of them have to pay for transport to go to work, so it's not possible for them to miss out on that day of work. That's why we women are the ones who are always going to a healthcare center or a hospital. Unfortunately, many of us have been told if you don't want to wait, go to a private clinic. They know perfectly well that we don't have the resources to pay a private clinic or a private doctor. So what do we do there? We raise awareness among the rest of the population so that we can all know about our right to health care. It's very important to us when we start to work. Working has been very important to us. Before, we didn't have ID cards or vests, but thank you to SEGs that provided us with these things. And some people don't like it. They'll say, those are the people that investigate us. They're here. But really, we're not investigating them because we want to do anything bad to them. We want to monitor. We want to have oversight. We want to improve the care received by users. We don't have bad intentions. We're not going there for the sake of going there. What we would like is for healthcare services in our country to improve. We would like very much to be in all of the municipalities in Guatemala, but we still don't have the capacity to do that, both in terms of the manpower as well as economic resources. I think that to date we have coverage in 36 municipalities and 6 departments where we have coverage as healthcare defenders. But we would like to have full coverage. There's still a lot for us to do. So that is why, as defenders, many people tell us that we are so very important because we are seeing evidence of what's going on in our communities. Before, when we did not exist, the Ministry of Health would always say that 90% or 85% of the medication is being fulfilled, that there's enough of a supply for 85 to 90%. That's why we monitored and did social auditing to see if that was the case, but it was not the case. And we have the evidence here in this short video so that no one can say that it's not true. We are working for there to be more honesty, to reveal the reality of what's going on in our most distant and rural communities in our country. I think we, as healthcare defenders, we don't receive a salary, but the situation we live in is what motivates us to organize so that we can achieve better health care. Thank you very much. Thank you very much, Doña Paulina.
Turn to Wunna, who we've heard in earlier sessions references to the World Bank's citizen engagement framework that promised to build processes of beneficiary feedback into all the investment projects. And Wunna has been doing independent field research to see what's really going on in the real world of a project. So please tell us a bit more about what you found.
Thank you. And it's my pleasure to speak on this panel. And I feel like this is a great opportunity, at least to share my experience working in my own country. Yeah, I work with BIG. My name is Wunna, first of all, and I'm based in Yangon, Myanmar. I work with Bank Information Center, but based in DC, but I'm based in Yangon. So I think started in last year, we have a partnership with the ARC, American Universities, and trying to do a research, to look into the World Bank Citizen Engagement Framework, the operationalizations in countries, which include Myanmar as well. So my role is more like, trying to look into the targeted projects and also looking at their commitments of the citizen engagement framework operationalizations and also the actual implementations of the citizen engagements in the different projects. So we had a chance to look into some key projects, including the Community-Driven Development Project, CDD. That's one of the biggest portfolio investment of the World Bank in Myanmar. And the second one is the Essential Healthcare Service Access Project. And the third one is they call it ARD, Integrated River Basin Management Project, ABM in short form. So I actually been to different communities, in the villages, in different communities, ranging from the ethnic areas, also to the, semi-urban area as well, and talking to different people. So I think I will be able to share the Essential Healthcare Project, at least what I found out. And I think that project is very promising one, like in terms of the empowering the local communities to be able to speak up. And particularly that project is intended to create a comprehensive, township health plan, which is, I think, very similar to the case to Guatemala as well. So in that plan, how are they going to, draw out that plan is basically in each, villages, not each villages, at least like one village is 5 villages. We call it, rural health centers. And in that rural health centers, they form the rural health committees. So that project is actually trying to empower that community, committee, so that that committee can actually participate in identifying their health problems in the village, and then develop their own priority plans to sort it out. So that will be feeding into the township level. So that at the township level, they will have the comprehensive bottom-up township plan, and then based on that, the government will allocate the money for that. So that's the idea of the plan. I think the essence of the project is to empower the local health committee. And that's a plan, that's the project goals. And when I actually been to the community and talking to the different public health officers and the health committee members, I think one thing that I noticed is, I think the prominent one is the gender perspective. I think I talked to 4 or 5 health committee members, but there was no woman involvement in the health committee members. That's at the village track level. So if you look at, because the project also says that will include the priorities of the women and also marginalized and underrepresented groups of the community, to include their health issues and trying to sort it out. But how could that be possible if there is no representations of women and also most marginalized and underrepresented people in the health committees? So that's one thing. The other thing is, I think the third-party monitoring. And so far I talked to them, and then no one actually mentions that there is a third-party monitoring of the civil society actually happening in the projects. That's the one thing. And the other thing is, very basic, I think, that's the operational manual. The fact that someone mentions in the morning sessions, as Jonathan mentions in the previous sessions. I think the basic information as a community member can get it in order to be able to participate and then get engagement in the project. I think the basic document is the operational manuals. But it's so difficult to find the operational manual, both in English and also in the local language. The fact that is most of our people, we don't speak or we don't understand English. And that's the thing. And then when I actually talk to the public health officers who are the main implementer of the projects, sitting at the township level and also village tract and the village level, no one actually know what is the operational manual. I talked to them, they said, what is operational manual? We never heard of it. And then I asked, okay, do you have any documents, given out from the project? And then they just show me a document which is on like financial management. They call it financial management procedures. Rather than it says that rather than trying to give the essence of the project, they are trying to ensure that the people sit in the village tract level and township level actually follow the financial rules and regulations of managing the projects. So what I see is that, if they could actually make it happen to empower the local communities to identify their problems and prioritize them, that is also part of the democratic cultures. That what I see is so that people got empowered, and then they are not only be able to participate in the World Bank funded project, but in a larger sense, they can also have a voice, and then they also empower that they get involved in the government mainstreaming other development plans as well. So yeah, I think that's a thing, and also we also have a lot to talk about in the consultations as well. The consultations is mainly happening at the township level, but the thing they are implementing is the village tract level. So there was not really consultations happening at the village tract level. And also the grievance redress mechanisms, I think that's also the essential part of the citizen engagement framework. And no one actually knows there is a GRM set up. And then as far as I know, they set up they call it Facebook Messenger group. I think everyone familiar with the Facebook here. They set up a Facebook Messenger group for the BHS, we call it Basic Health Staff members. You can complain or you can put your grievance, but it has to be in English. The thing is, all these basic health staff, they don't speak English, or they are not comfortable to talk about English in the group.
Great, thank you very much, Wunna, for that reality check about the challenges of translating projects that say all the right things on paper, and then the reality on the ground may often be very different. So now let's turn to Nani to learn about PEKKA.
Hi, are you awake? PEKKA, Women-Headed Family Empowerment, we established during the post-conflict in Indonesia with the economic crisis 1998. So we start organizing the grassroots women-headed family, mostly widows, divorced, single women, abandoned women. We started in the conflict area and post-conflict area during that time. Now we are already working in all across Indonesia, reaching 20 provinces of Indonesia, more than 1,200 villages. We organize the poor women-headed family around the issues of visibility and recognition of the women as the head of the family, and equality, right and justice of the poor women-headed family to all the resources and services of the government. So that's all. Oh, no.
Great. Thank you. So I want to now go back through our panelists and start with Joy to ask if you could say a few words about how GWATCH specifically addresses the role of grassroots leadership development. What are your strategies for supporting your grassroots colleagues to build their voice?
So going back to the idea of learning from the experience of the Philippines, grassroots leadership, or the idea of empowering grassroots, that's not new. Philippines have had decades old of experience on grassroots leadership, and the organization is trying to develop an approach to it that would take into account what had been learned. And it's in the Philippines, empowerment of citizens and empowerment of grassroots had been a kind of a strategy of democratization for decades. Yet now, you have a situation where you have a president being supported by 80% of the people, despite, allegedly killing 20,000 people. So what I'm trying to say is, in trying to understand grassroots leadership or grassroots community organizing, we need to take into account some of the lessons learned from the very long history of grassroots organizing. And some of the key reflections there, if you look at the Philippine experience, it's hard to romanticize or patronize community and grassroots organizing as well. Because especially in this context wherein the patronage networks have already been extensive, where it's very, if you look at the ground and you look at the grassroots, it's very easy to see how the corrupt as well as the citizens are actually, in a way, in a very close web of relationship that it's going to be very difficult to do accountability. So that's one part of the reality. On the other hand, I guess if it's coming from a national or an international organization, grassroots organizing should not also be taken up as if it's a task of a savior going to the field, empowering those who are on the ground. I come from the province, from a poor family, and the kind of difficulty that those on the ground are experiencing is not as bad as what some of the difficult issues that are confronting by rich people in rich countries. So it's the attitude of taking up shouldn't be also coming from that savior mentality of sort. The grassroots, the international and the national need the grassroots more than the grassroots need the international and national. And it's important to take into account how we do not just use it as another buzzword, and really learn from the experience of the past. And so the content, when we talk about grassroots leadership, is very important. Cannot just be instrumentalized. And in the experience of GWECH doing this, and I'll elaborate later on, given that realization and reflection, it's always important that when you capacitate the grassroots and communities and organize the communities, you do not look at it as a separate from organizing of the different levels as well. Just as we cannot win transformative agenda just by organizing the grassroots, we cannot also just win a transformative agenda without the grassroots. But there should be a collective action across levels that has to be undertaken. And by that, in the experience of GWatch, before we were thinking of just sustaining the local monitoring initiatives that we've done all over the Philippines on their own, with this local monitoring initiatives of health, community-based sustainable tourism, education, environmental users fee, different services that had been monitored by the communities. And our thinking was, okay, organize the monitoring teams and embed it, institutionalize it through policies, etc., and let them move on and carry that through. And if you look at the experience of social accountability in many decades, the reality is that is not going to be sustained unless there is an active facilitation and an active support provided from support provided for these initiatives. So localized, autonomous organizing alone, and even at the grassroots, would not be able to come up with that kind of muscle and power that would put forward transformative action necessary to sustain all these democratic efforts. So that's when our idea is to build and consolidate all these different localized actions and try to nationalize it into a loose network. And the idea there is shared ownership of agenda, shared analysis, and interdependence, which means it's not, one part is not more important than the other. Everybody has to contribute in trying to come up with a new form or new movement that would advance a different way of doing accountability. So grassroots, yes, but not romanticizing the grassroots, but at the same time not also belittling what it can do in a transformative social accountability.
Thanks, Joy, for reminding us of the importance of a multi-level and multi-actor approach. Now another question for Paulina. As a grassroots health defender, ¿ya está conectada? ¿Sí? You've often faced pushback from health authorities who are not ready to listen. Why is it important for you to have the backing of your community, and how do other members of the network of defenders support each other?
Bueno,
First of all, there are authorities that don't have the political will to support organizations and healthcare defenders. It's as if having a dialogue, they just say no to having a dialogue because it's not on their agenda as authorities. So we insist on them having to listen to us because they have the obligation to give organizations the opportunity, to give us as defenders the opportunity to be able to improve our communities. When we were chosen by an assembly. And when the assembly elected us, chose us, I said, we can't do this alone. If something happens, we have people that can support us. We need people to support us. So we spoke to the mayor, and the first thing the mayor told us is that first you have to register yourself here in the municipality so that I can support you. And we said, that's not a lot that's being asked of us. We just have to hand over some documents and register ourselves with the municipality. And in other municipalities, we're viewed as an official auditing system that is part of the government, when in fact that's not the case. Others think that we as healthcare defenders are going there to take work away from them, but that's not the case either. So many authorities say that we don't want any problems with the community. And then we start explaining the work that we do carry out. And when they realize that it is important to work together on healthcare and on education, but also there are commissions in all of the municipalities. For example, the Health Commission or an Education Commission, an Environmental Commission. But unfortunately, they don't work, they don't participate. As defenders, we have made them participate with us. We had to demand that they be with us because it's important. So currently, about a year ago, a complaint was lodged against me for carrying out this work, even though it's volunteer work. But the first time that someone had lodged a complaint against me, that the director of a program had complained against me, I asked myself, what am I going to do now? Am I going to stop or am I going to keep going forward? Unfortunately, I didn't tell my family that they filed a complaint against me. I was waiting for some sort of notice, but I didn't receive anything until I was invited to a national level meeting, and I went, and the note arrived. I didn't want my family to know about this, but they left it at my house without me being there. So I started to analyze the situation, and I thought that many times we're intimidated. They try to defame us. They intimidate us because they think that we ignore everything, that we should be ignored because we're women, but that's not the case. So I decided to keep moving forward with this struggle. It's not just for my family, it's for the whole community. Then we held another assembly that doesn't focus on health, but rather in our country we have COCODES. COCODES are like another community committee that concerns itself with the needs of the whole community. So the people at the assembly voted me in as the president of the COCODE, as I represent the community as a health defender, and I'm also represent my municipality. So that's where we see that there is a need to work in a well-organized manner. If we're not organized, we cannot achieve anything, but we should organize ourselves around an objective that can bring us to a better place. That's her goal. But we can't do things that don't take us to that better place. It's better to follow a path that everyone can follow together with the youth, because that's what's really important. Our authorities will say that we cannot invest in healthcare and education because the law does not allow it. And when SEGS gave us a training, then there are resources, and the municipal code did allow resources to be destined, but they don't have the will to do it. With the former mayor we worked with, us defenders achieved a little bit, but it was through advocacy work with other governmental institutions. For example, the PDH, we're doing advocacy with them. So the governments will do this, but not everyone has the will. But we make them have that will by raising awareness, by teaching them that healthcare is a right for everyone as a human being. So there's a lot to say about the authorities, but thank you very much. Wunna.
Development. I wonder, in your research on the World Bank funded projects that you're following, in what ways do they actually invest in building the capacity of grassroots voice, if at all?
I think that's a very tough question for me. Based on my own experience doing the research in Myanmar, Yeah, I think that like citizen engagement itself is a way to build the grassroots leadership. I mean, if it is carefully designed and it is like carefully implemented in the community, because if they look at all these projects, CDD, they build the community development committees, village development committees, and also in this health projects, they also try to build the capacity of the village health committee. And but the thing is, I think when you talk about the leadership or any grassroots movement, I think it takes a lot of time. You can't just achieve just like that. You have to be consistent, and then you actually have. It takes time to build the trust, even because like in Myanmar context, the trust between the communities and also the government, people like government has been destroyed for many years, and then we are just at the very beginning. So in that case, you can't really implement the project and then claiming that you are successfully building that citizen engagement in the community, which is not true. I think the time is that you have to be consistent, and then at the same time you also have to be, I think, constructive, because very often what we hear is that, oh no, actually, you know what, we invited the community to participate in that consultations and in that in these consultations, but they never came. The thing is that it's not that they don't camp. The problem is they can't camp. I mean, because they have been struggling like hell, for their daily livelihood. The thing is they don't have time. You are also doing that consultations, in a place where most of the people are not accessible, as a community members. They are not accessible to camp there, participate in the things. And then the other way around, people are also talking about, no, you don't. If you actually want to get the participations or the engagement from the grassroots people, I think, you don't bring them. You actually have to go there, where they are, they have free time probably, after working hours, 6 p.m. in the evening probably. So you do the consultations that time. If you are genuinely, sincere enough to get the people participations and engagement at the community levels. And the other thing is that, as I said, it's about, constructive, and also sometimes it's a consistent engagement with the grassroots people. Because just one example that, which is outside the research that we have done together, I think it's about my own experience working as a youth, like 2 years back, where in Myanmar, government announced that they wanted to have the national youth policies, but we never had one, back in the days. So they wanted to do it. The thing is that because of I think the pressures, or also the requirements coming from the international communities or whatever it is, they wanted to get the voice of the young people. And then I think most of the young people, they wanted to participate in the process of doing that national youth policies. As a group, I was representing, based in the middle part of the country. So the fact thing that we need to do the leadership is, I think, to be the leadership, and also to doing the social accountability is I guess the building trust, like that the mutual trust between the government and also the other people as well, community, and also the youth. So it took us, just for example, it took us 3 years to get the trust from the government, because it's the other way around. The way government see the civil society and also the community is also very much important. Because sometimes the government, particularly in Myanmar context, government sees the civil society as an enemy, rather than seeing it as a partners. And then they are trying to repress, whenever they have chance to do it. And then it's the same to the communities. Whenever we are trying to organize as a community meetings or a community forum, government all the time, they will be asking, why are you doing that? What is the need for doing that? We are also trying to do it best for you, for the community, which is not true. The thing is that it coming out from their attitudes that they don't trust the people. Like, they don't even trust the civil society. They don't trust the community. Once we bring the trust, build on it, and build the consistency and the constructive engagement, I think, at some point of time, I think 5 years, 6 years, 7 years, who knows? I think we'll be able to build I think, a bit of the meaningful grassroots leadership in different communities at different levels.
Great. Well, thanks for reminding us of how a process of participation, if it's meaningful, is a form of leadership development in itself. And thanks also for putting on the table a very relevant term, consistent engagement, as distinct from constructive engagement. So now I'd like to turn to Nani, and one of the really most remarkable things about PEKKA is how your organization has made leadership development a strategic priority. And I wonder if you could share with everyone how that process unfolded.
Yeah, first, of course, the women-headed family is really invisible when we start organizing in 2000, early 2000, 2001. So it's not the word women-headed family even does not recognize in our constitution because head of family are male. So in order to really start doing this, we need to really organize the women who are in that position themselves, mostly widows in post-conflict area and the things. So what we do is it's ongoing training and practicing and doing thing. But the first thing we do is we build the space for the women to come together. I agree with what Wunna says. It's really the trust building and also opportunity for women to come together and then to exercise their power and their relations and how they can engage and also their capacities in this. So we form the cooperatives as the space for them to start engage each other with a very light way and simple way. So we don't talk the difficult things. It's really start with saving and the things. And then we build their capacity, and also this co-op become the space for them to exercise their leadership, accountability, and also skill building, communication skills, what you call interaction skill, even simple one, writing skills and calculating skills, all the things. And after that, through this group, then they identify what actually the dream they want, what they want to change in their life. Of course, because they're the poorest of the poor. So the first thing they think is always their family, their children, nothing. So building from this, then they identify different challenges that they face, especially in relation with the government services. For example, they always think of, oh, I want to send my children to school because I don't want them to become like me. And then what are the challenges? Because they identify the challenge together. Then we always throw it the question, so who will overcome this challenge? Whether somebody will help or you have to face. They said, based on their long time experiences, they have to do it by themselves. That's the way then they start. So how we do it, then how they can do it collectively. So we always said no one can help anybody for a long time. So they should depend on themselves and then the collective action. So it's always training. And then the leadership process based on our experience is not like one leadership training, then finish. It should be ongoing organizing process where when we develop several instruments that they can use to exercise their leadership and their engagement with the government. For example, we have what we call is PEKKA. This is the mobile clinic for consultation and information, where we bring our government from district level to the villages. Yes, as you said, if you want to engage grassroots, the government should come down. So we bring this space, PEKKA, as the space where the grassroots women, especially the poor women, who does not have enough time, capacities to go to district level to get their public services, including legal identity, all this kind of thing, social protection, to come to that PEKKA, which is run by the women themselves. So, and then they consult their issues, and after that, they follow up with the government so they can get all this access that they need. So with this instrument, with this space, they build their capacity, they develop their leadership, they build their trust, and also they communicate with their government, the local government. So we develop many ways, instrument, be creative in different contexts, how then we can bring these women into different level.
Thank you. So in the time remaining, I'd like to open up to discussion and any comments or questions from the audience. I don't know if we can have some help with fielding the microphone. And maybe we'll take 3 or 4, and I think we may just have time for 1 or 2 rounds. So who would like to go first? Yes, in back, and then over here, and then over there. So we've got 3 already.
Okay, thank you so much. My name is Sanjay from the Affiliated Network for Social Accountability in Cambodia. Okay, first of all, I would like to thank for allowing me to say first. And I want to say something about our experience in Cambodia. We are working with the indigenous people, and we start the local leadership by capacity development and in the approach of learning by doing. In order they are to be the community facilitator, community accountability facilitator, CAFs. And they work proactively through our capacity development in coordinating coordinating the citizen-led monitoring of the public service delivery of the primary education, health center, and commune service. As the result, when they were found as the active group, the local politicians are interested in their works and want to mobilize them to involve with their community campaign or commune campaign as well. And some later on, some become the commune council member, and some work independently. But the challenge is that after they were found as the active group, the local administration, or in Cambodia called subnational administration, want to organize them again and get them under the public administration. That we have the concern over any the independency of of their work in public service delivery monitoring. So from your experience, what happened in the Philippines, like as Joy mentioned about coordinating and organizing the group, and then how to get them independent from the political affiliation at the local level. Thank you.
Okay, thank you. And then here in front.
Thank you very much. Once again, my name is Ediot. I'm from Uganda. I work for Women and Girl Child Development Association. I love the conversation, but it's like your world is different from ours. We have been organizing as women of Uganda, but it has been so complex in a way that because of having multi-party systems in Uganda, that if women come out to organize, maybe just to be health defenders, the government must understand exactly how you're organizing. They want to know the person who is organizing. And if the woman is from maybe the opposition side, then the questions have to raise. there are issues, you know exactly what has been happening in Uganda, where most of the women and girls have been being killed. And then just that organizing and say, no, we need to know, we need to see the government investigating on who is killing the women. And then again, the government has to ask, who is that woman raising the voice? And then they must make sure that you zip up. If you don't, then you are either kidnapped or in a way. But in terms of social accountability, maybe, I just wanted to ask again, when the woman started talking about issues of organizing, issues of gender and equity budgeting, and then the government was like, why are you talking about gender and equity budgeting? Why do you want a budget for women? And then maybe in our advocacy, it a little bit advanced in a way that the government started allowing, and I must say maybe Uganda is the first country to have a compliant issue on gender and equity budgeting, where every sector has to have a gender and equity certificate to be able to give you money from the ministry. But again, it is a political issue. You find, again, if we are organizing as women, if let's say we are talking about issues of health or agriculture, then again, it has to be an issue. Are you from the ruling party? Are you from the other party? And why are you asking money maybe to be increased in agriculture? You know, I just want to learn from you, but otherwise, I really love the way you do your work, and I am like, I need Ugandan women to be here to listen. I mean, talking to the mayor has to ask, are you from movement? Are you from the multi-party system? And so I don't want to be questioned. So the big issue is the big word fear. You know, you want to organize, you want to defend, but fear. Thank you very much.
Thank you. And then in back here, please.
Thank you very much. My name is Tendai. I'm from Zimbabwe, from the Municipal Development Partnership. I think after Uganda, I also relate to what she's saying to some extent. Okay, but I really like the presentation and the work which is done by the defenders. So I have maybe 2 questions, especially on the health defenders. One, I would like to find out on how sustainable the defenders are, the work that you're doing, especially I see your leadership qualities. In case you leave, are we going to see this work going to continue? Or it's your passion as an individual? How is this knowledge transfer maybe to other civil societies or to other individuals in your area who can continue with this work, especially when you are not around? And okay, so that's also the integration of knowledge within the grassroots levels. Is this happening? Are there some trainings which are being done also to transfer knowledge from your organization, the defenders, to other defenders? Then also I would like to find out if it's only in the health sector which this is being done, because I think it's a very good model which maybe can be transferred to other sectors. Maybe you're looking at the education sector. Do you have such intentions to move to other sectors? Then maybe I just briefly, in a case for Zimbabwe, especially looking at the grassroots leadership development, in Zimbabwe, it's very difficult for civil society at the local level, especially the really grassroots level, to do it without the baptism or without the local government at that level welcoming them to do it. So you really need government to be on your side, especially for Zimbabwe, if anything has to move. Without them, the space is closed. But when you start to plan together with them from the beginning and to tell them your intentions, they are starting to open space for that. So it's maybe since recently that in Zimbabwe you're having some space opened up. But the challenge that we're having is that civil society as well was used to a closed space, and they are not yet open to forthcoming to engage. So which is one challenge that we are facing in Zimbabwe. So for capacity building, investment has to be done both sides, to the civil society and also to government at sub-national level and even at national level. Thank you very much, but I really liked the case study. Thank you.
Okay, so we have just enough time for each of our panelists to say a few words and reflect on what we've heard from the audience. So please, Joy, kick us off.
Quick answer to the specific question that was raised by Sanche. I think the inputs that are coming from the audience now point to the reality of how different and complicated organizing is nowadays. There are the government as well as politicians and different political actors have already adapted. They know how civil society and human rights groups are organizing, and they have already found their own ways of neutralizing, co-opting, appropriating all this. The reality of how do you insulate organizing from partisan politics is a valid question. And the reality of threats being confronted by organized, especially in conflict areas. What you said as the constraining spaces because of government regulations, which in a way limit what we can actually do and oblige us in a way to think of strategies that would be more cooperative or constructive with the government, even if we know that that will only give us really very limited victories. I mean, all these are the different new age problems of organizing in this day and age. So let me share some, I guess, key reflections on new ideas about. We've done a study recently on the campaigns for agrarian reform in the Philippines. That's highly contested campaign. We introduced the idea, we introduced there the need to look at anti-accountability forces in strategizing collective action, because these are the forces that you need to deal with in trying to put, and they are not always evident. In the case of agrarian reform, it's evident landlords, but in some cases, they are not evident because this are actually could be bureaucratic processes or any, for example, in the paper that we're doing on bottom-up budgeting, some veto players within the bureaucracy. So these are different forms, different ways of anti-accountability actors that could neutralize the effectiveness of organizing and effectiveness of social actors. So it's important to take note of it. And we've in our study on vertically integrated monitoring and advocacy campaigns, we've come up with certain tool of mapping not only the different actions and approaches that can be utilized by us, citizens, in organizing collective action, but also in a way of mapping the different multi-level actions and approaches that can be utilized by anti-accountability forces. So that's I think right now it's good that social accountability, this field is starting to realize that this is not really just all harmonious, and there is really evident conflict in the work that we do. The other point, which is also I think in a way respond to the last question. Maybe we need to rethink really when we talk about leadership formation if it has to be like a toolkit, or do we want to do it with a very strong emphasis on context? And this is where in this also new space, as we come up with different, we identify agenda, how do we come up with agenda that recognize that there are inherent tensions among agenda between and among agenda at different levels of different actors that are coming together if you want to do coalition building. So coming up with balanced agenda setting and balanced agenda setting process and shared analysis of the problem would be, I think, a key point that would enable us to not only just build the capacity of the grassroots, but really build collective action that would involve grassroots and different actors at different levels. The last point is, which is a pitfall that needs to be taken into account in discoursing grassroots participation. We need to be relevant and responsive to what people need. And we've been very particular about coming up with initiatives on the ground that respond to what our local counterparts find most relevant in their area. But at the same time, we know that transformative agenda are not exactly those that are immediately felt, that immediately address felt needs of citizens. And this transformative agenda, national agenda, could be institutional reform. For example, in the context of the Philippines, that would be, say, electoral reform. This is not something that someone on the ground would say, I want to be able to monitor this, or I want to work on this. It would likely be education, it would likely be concrete services that benefit them on a daily basis. But there are transformative agenda that we will have to take up, or else this cycle of poverty, underdevelopment will continue. And we will not end really responding to these problems. Instead, even perhaps deodorize a culture of impunity and the kind of system that we have. If we are unable to really take up the big picture and big goals that are causing all of this, all of the problems that we're trying to solve in the first place. So the point of ecosystemic view of accountability, this idea of being able to come up with an agenda that would address immediate gains, but at the same time long-term goals, and how do you tie it up so that you don't just respond to felt needs, immediate needs, but at the same time build on it towards really institution building and deepening of democracy. I think it's big, it's broad, but unless we take up the complexity of that, this gathering that we keep on doing for decades now will just be the same, and we will be speaking of the same thing over and over again.
Thanks, Joy, for that reminder of the systemic context. And now for the last comment from Paulina.
In terms of the question made or asked, I think that is why we as defenders have involved the youth, so that they can do follow-up when it's the time for me to leave, or because I pass away, who knows? But we're doing a sort of transfer of ideas and experiences. And something else we're doing is that we always provide the organization with information from the grassroots. We don't only have the knowledge of the work that we carry out, the communities where we have coverage also have this knowledge. And we would also like to have all of your support, especially SEGs, so that we could, and we would like to receive financial support so that our experiences that we have had can be disseminated, because it's really not easy, and for us to facilitate these processes. I'm here and I'm not shaking anymore, but when I first started, I couldn't even in my family participate in conversations. I was scared, I was embarrassed. But after the peace agreements, when we started to organize ourselves, it's been very important. I understand what we've expressed up here, it's not easy to be a community leader. In my country, there's something we always respect as a culture, as a tradition. Why? Because each and every one of us, as human beings, have a navel, if we're dedicated to be leaders, then we can go ahead on the path of supporting our community. If our destiny is different, then we have to start working according to what our destiny says. That's why we always try to transfer the small amount of knowledge that we acquire in all of these spaces. And another thing that's very important to us is that the majority of our female community members participate, but when we started, you're going to laugh at what I'm about to tell you. What did they tell me when I first started? When I first started saying, we're going to have a meeting, and the husbands would say, no, don't go because she's going to teach you how to find lovers. I didn't even know how to do that because I was 17 or 18 at the time. So I started to participate thanks to my parents, who never told me not to participate. They never said, don't participate because you're a woman. Family support from our parents is something very important, and support from our friends, because that helps you be stronger. So it's more, we have to involve all of our female community members and all of the men as well, because it's not just we as women that have the right, but also men have the right, and young people have the right. The other question, in my country, there's always been the criminalization of leaders. There's corruption. The first thing that is always said to leaders is that this is the head. We have to get rid of them. Or we need to have her sent here, or we need to accuse her of something, of a crime. And they accuse us like that. And that's why we're taken to jail. I have women partners who are in jail, women leaders who are in jail, but it's because of the same situation. I think that as women or men, it's a struggle. It's a struggle for us. Because no one's going to fight for us. But if someone from a different country or a different world can support us in how to defend ourselves, it's true, I'm a defender. But who is going to defend me? How am I going to defend myself? So we still don't have this strategy. We don't really have an argument right now as to how to defend ourselves as defenders, because I defend, but how am I going to be defended? That's why it's very important when we, as defenders, have to find spaces and advocate mostly in terms of human rights. And many times human rights officials don't support us either. And to the contrary, sometimes they tell us, you deserve it because you did this or that. That's why I said, who can defend me as a defender? we are lacking a strategy for defenders so that we can enjoy a better quality of life. Also, if someone defends me, that means I have the security to be able to defend others. So it's a long path, but at the same time, we have to start analyzing these things. That's why it's very important when we talk about trainings and group discussions. We always do that. I am always so grateful of SEGs because it was through them that we can provide information about the right to health care over the community radio stations. And we can establish information desks in different communities. And many communities are grateful because the truth is they don't know the right to health care. When we're mistreated at the healthcare facilities, we're the ones that are afraid. And that should not be the case. To the contrary, the person who's working earns a salary, and we are the users of their services. So they have a job because of the taxes that we pay. So if I'm not there, they're not going to have a job. So we have been strengthened and we have been empowered. But now, how do I transfer this to others? This is something that we're thinking about and analyzing, and it's a big challenge. Because as I said, it's not easy, but it's not hard either. Thank you.
Wunna. Final comments.
Okay, I think just two comments. One is I think one thing I see over the period of time is the political commitment of the government, in relations to the CDD projects that we talk about. So I think, just to make it short, that CDD projects, and they do the consultations, they do all these grievance redress mechanisms, they do this and they do that. But their government department is the Department of Rural Development. That department is, in every township of the country. But CDD project is not in every township of the country. But they do all the consultations when there is a CDD project. They don't do any consultations or any type of the citizen feedback or any type of the citizen engagement in other township where there is no CDD project. So the thing is that government does the project because they want to get the money, that's it. They don't really have the political commitment to do so, to do or to engage with the citizens. And then I think the perspective or the attitude of the bank also has to be divided in some way. Because when I talk to these people from CDD, no offense, they said that we are happy to expand that CDD project to every township in the country. So this is not what we want. This is what we are trying to say is that no, you can't expand to the whole country because you are trying to put us in the debt, But what we are trying to say is that why are you going to achieve your project ultimate objective? It's not just delivering the project. It's more about building the capacity of the people so that they can lead their own development process. So that's one thing that political commitment. And the other thing is that no, you have to focus more on the scale transfer because our country has been closed for more than half a century, and then we don't have the skill. Even though they have a will, at least at the service delivery level, they may have the will to do the public services better and quality for the people. But the thing is that they don't know how to do it. So rather than you are focusing and asking or the government to take more money, but you have to showcase, you have to transfer your skill to these, at least to these, local government officials who are sincere enough to serve the people. I think the lesson is the civil society, and then again the consistent engagement. What we see is, in particular, the Myanmar context is, so civil society is changing their directions as well. I think not civil society, at the donor institutions, they are changing their directions all the time. And I know if it is a case of the peace, and then they will go to the peace sectors. If it is a case of the leadership, they will invest all their funding in the peace sectors. And then if it is a case of the disasters or the humanitarian crisis, they will shift their orientations to that sectors. And then at the very beginning, we talk about the consistent engagement. If you really build the capacity or build the grassroots leadership, so there is no problem you diverting your way, but at least you have to be consistent, in building, or if you are sincere enough to build the leadership of the grassroots people in the country.
Thank you. Nani, please.
Just 2 points on the political engagement. We look at that as opportunity. For example, in one particular district, we have the PEKKA association, the PEKKA membership group organization, control over 25% voters there. So they negotiate with the political party as well as the leadership on the agenda. So they are not engaged directly. But now, for example, now we have more, around 52 our leaders engage with the political party, run for the election for next year. So we also equip them with some tools for analysis and also for their accountability later. And second, on the difficulties challenged by the different layers of power, we are not only have difficulties with the formal power, which is the government, but also with the hidden one, which is the informal one, like the indigenous leaders or religious leaders who actually become a part of the challenge. So we also engage them in the process, so they become our allies in some difficult issues.
Thank you. Let's thank our panelists. I'd also like to thank our interpreter, Julian Roberts, and to thank GPSA for making the interpreting equipment available. And I'd like to invite you to take some publications about this work here on the table in the front. And now the next panel starts in 10 minutes, so it's time for us to move along. Thank you very much.